Hi, my name is Dr. Joanne Stone. I'm chair of the Department of OB/GYN at Icahn School of Medicine at Mount Sinai. I'm also a maternal fetal medicine specialist and the director of the first Rainbow Clinic in the United States that's held here at Mount Sinai. Thanks very much to Push for Empowered Pregnancy, who support us along the way. And we're really here today to recognize National Rainbow Baby Day. August 22nd is always the day that this is dedicated for this, and it's a day when families across the United States commemorate the loss of their infants, and while celebrating motherhood as well. So I'm very here to commemorate this special day.
Hi, I'm Fernanda Sheridan. I am a lost mom. I lost my daughter, Natalie, at 38 weeks of pregnancy. And now I'm a co-director of the medical innovations at Push for Empowered Pregnancy. And I'm here to help improve maternal fetal care however we can.
Hello, I'm Marny Smith. I am also a lost mom. I lost my son, Heath, in 2019 at almost 37 weeks. And I am also a founding member of PUSH and co-director with Fernanda of medical innovation at PUSH.
So really the goal of the Rainbow Clinic is to provide very personalized and specialized care for patients who have had stillbirth in a prior pregnancy. We meet with patients often prior to becoming pregnant and work on understanding possible causes for their loss and formulating a plan of care for them throughout their next pregnancy. And then also take care of patients throughout that pregnancy or consult with them and make a plan in case they are not in the proximity to Mount Sinai, but seek to get their care elsewhere. And we really, ultimate goal is to prevent stillbirth, right? That's really what the total goal is, the prevention of preventable stillbirths. So stillbirths in the United States occur in about 1 in 160 births. About half occur between 20 weeks and 27, 28 weeks, and the half occur 28 weeks and beyond. And as you can imagine, it's just really unimaginable for patients to undergo this. So, and it also varies, and there's certain risk factors for stillbirth. So greater chance for stillbirth in certain patient populations or with maternal medical conditions. And then especially stillbirth is really increased in patients who've had a stillbirth. And that's why a special clinic devoted to caring for these patients to prevent a recurrence of a stillbirth is so incredibly important.
It was my idea first. I'm one of the co-founders with Marny, but I had my kids at Mount Sinai, so I did experience firsthand the excellence of care, prenatal care. And then when I had my experience with stillbirth, I asked around Manhattan in a lot of moms group which doctor I should see for my following pregnancy. One, to try to understand what had happened, and second, someone not only skilled, but could help me go through the pregnancy and holding my hand. And it was a unison. Everybody told me, go see Dr. Stone and go try to get your appointment, even preconception. And so for me, it was a no-brainer. The problem was, or if she was going to accept or not. So, and thank God she did.
No, it's a great question. I think, one of the biggest gaps, I think, is first trying to understand what happened. And so honestly, the initial consult, I'm always running late, which I have to fix because spending like a good hour and a half to 2 hours with a patient to go through all the details, all the records, and try to understand what happened, and then formulate a plan for the future pregnancy if they're currently not pregnant, or if they're coming to me pregnant, and again, going through that process, but outlining what the care will be. And I think some of the gaps are, number one, having that time to devote to patients who really deserve that kind of time. And then approaching it with compassion. I've really learned so much from Fernanda and Marny about this. They've developed an incredible training session that all of our staff, the doctors, the receptionists, the people that answer the phone, our sonographers, all have gone through to understand what patients have gone through and what their needs are in a pregnancy. So, as you've heard Marny and Fernanda talking about Heath and Natalie, it's really important for the staff to understand, like, we need to recognize their children. These are their children who were lost, and mention them by name if that's what they want. Also providing mental health services, because it's a very stressful pregnancy when you're pregnant in the following the stillbirth. So we have a social worker that's specially trained in this. We have nutritional support. And then the other thing is just knowing that for patients to know anytime they want, they can come in. I tell them, like, if you have to come in every day, I don't really care, like, that's what you need. And again, we base the care, based on what potential etiology is, and then do really frequent ultrasounds for growth, looking at the placenta, looking at the fluid, the trajectory of growth, and do intense fetal monitoring, and then earlier delivery. So those are some of the foundations of the care. Of course, it's individualized, like I said, if somebody has diabetes or high blood pressure or things like that. Those are the foundations and the gaps that we try to address. So I think one of the things is that, again, the social work support, the nutritional support, the ultrasound exams, the placental volume assessment that we do, really a lot of focus on fetal movement, and being involved with research that hopefully can help to improve things further. So we collaborate with Dr. Heasel, who's internationally known in this field, and he started the Rainbow Clinic in the UK. They now have 20 of them, and he's been really instrumental. And thanks to PUSH, they've partnered, with us to help organize and incorporate the things that they've done there. So we're participating in research to see if we can emulate the same good outcomes that they have there in the UK. So we're collecting that data, and then we're also focused on new innovative research. We have a team here at Mount Sinai that we're excited to work with, who are developing wearables. There was one device that we saw that, I just looked at briefly, the size of a Band-Aid, and it can monitor fetal movements. It's amazing. So more to come, but really exciting to be involved with the research as well.
It is such an unexpected death. I mean, I'm sure a lot of them are, but it's a little bit more because it's the birthday. The baby should be here. I couldn't stay home alone. I started having panic attacks. So that's how my body reacted. I couldn't stay home by myself. I had to sleep with my husband also. He wanted to sleep with our son, Nate, who was 3 at the time, just to ensure that he was there, he was alive, and he was among us. I started having some paranoia that anything would happen to him or my husband at any time. And then there was like intrusive thoughts that Nate was gonna have cancer, or there's airplane going to hit my husband's building where he works. You don't have much control, but you're in I think your body's in a shock, your mind is still trying to make sense of what happened. And doing the support group at Mount Sinai helped me a lot. And also meeting other lost moms who I started volunteering with. I think it helped me make sense of my loss. And between my husband and I, it does put a strain in the marriage, of course, and everybody grieves differently. He didn't want to talk about it. For him, coping was just get time pass and fill out with other things, getting distracted. And I couldn't stop talking about it. And at one point, I remember I made him cry so much that I thought it was worse to see him crying than not having him talking to me about that. So I start reserving those my thoughts and my conversation to the support group or other moms that been there, and spare him of the suffering. So
I think that the extra care that I received with Dr. Stone was really instrumental in the successful birth of my daughter, Zosha, who is now almost 1.5. She is the light of my life. And, you know, if you look at my prior care, which was with another doctor, and then look at my care with Dr. Stone, I think that you have a different outlook, and you have, you can just breathe a little bit easier when you know that your doctor is undeniably in your corner and really has your back. And the physical really goes hand in hand with the mental and emotional support. I remember in the first trimester, I started having some spottings and a little bit of bleeding, and I had an appointment with Dr. Stone the next day, but I called, and obviously she knew my history. I was already established as a patient with her. And, you know, she just said, come in today, come in right now, come in today. We don't want to wait till tomorrow. And that was something I really appreciated, because not every doctor is going to do that. And not every doctor is going to take things as seriously as you do. You know, no one can promise you a live birth, but I knew that with Dr. Stone, I was going to have the best chance possible of having a live child. In terms of emotional needs, well, you definitely have heightened emotional needs, shall I say, is an understatement when you are going through pregnancy after loss. It's, you know, without a doubt, one of the hardest things that I've ever experienced. As Fernanda said, Dr. Stone was really highly recommended, especially in the loss community. I knew someone, and I know someone who specifically had her rainbow baby with Dr. Stone. And I even actually met with Dr. Stone. We did a virtual consult before I was even pregnant with my rainbow baby, because I was so concerned with, you know, getting the right care. And, you know, of course, she has incredible credentials, but when you realize that your doctor really cares about her patients, it's a game changer.